talk about donning and doffing PPE. Now, this entirely depends on what type of isolation your patient's in, so make sure you know specifically what PPE to use. Now, in this video, we're going to assume our patient is in droplet and contact precautions, and there might be some splatter, so we're going to use a gown, glove, goggles, and a mask. For starters, remember that PPE should always be donned and doffed in a doorway or in an anteroom, and you always start with hand hygiene. So the first thing you're going to do is apply your gown. Now, if you have a little plastic gown in a package, obviously remove that first, open it up, and find the sleeves. You want to put your arms in the sleeves, making sure that your thumbs go in the thumb holes if there are any, and then you can put your head through the hole or tie the gown. Now, in this case, we have ties around the neck and around the waist. So always make sure your head and neck is done first, and then secure the ties around your waist next. So once you've secured the ties around your waist and your gown is secure, you can put on your mask. So for a standard surgical mask, you want the ties to be in the middle of the back of the head and at the base of your neck. If you have a mask with ear loops, then simply loop it over your ears, pinch the nose piece over the bridge of your nose, and pull the bottom of the mask over your chin. Now you can apply your goggles. Now remembering the order here is pretty easy. If your goggles were already on, it would be hard to get your mask on. So mask, then goggles. Now finally, you can apply your gloves. Just make sure that you pull the cuff of the gloves up over the wrist of the gown so that you're fully protected. Now, once you have both gloves on, you are ready to enter the patient's room. Now, once you're done in the patient's room, you have to take off all the PPE without cross-contaminating anything. So what you need to know now is what parts of the PPE are considered contaminated and what parts are clean. So basically everything you see here is contaminated. The front of the gown, all of the gloves, the front of the mask, and the front of the goggles. What's clean is the earpieces and ear loops of the goggles and mask, the ties at the back of the neck and the ties at the back of the waist, as well as the inside of the gown and gloves. So when you take off your PPE, you have to think about these things. Now we're going to show you two ways. The first way is the way the CDC approves and teaches, and the second way is a little more practical and what it really looks like in clinical practice. So we'll show you both. Now with the CDC way, the very first thing you're going to do is remove your gloves by taking one off inside out, balling it up in the other hand, and then carefully removing the other one over and throwing it away. Now remember, what's clean is the back of the ties at the neck and the earpieces. So take your goggles off by the earpieces and then carefully reach back, touching only the ties, release the ties at the back of your gown. Then you want to remove the gown forward. You might need to make sure that your hands are actually inside the sleeves. Again, the inside of the gown is clean. So carefully pull your hands inside of the sleeves if necessary. Then you're going to take the gown off by rolling it up and pulling it forward. Again, only making sure that your hands touch the inside of the gown or the ties. So now you ball it up inside out so that you're touching the inside of the gown and you can throw it away. And now you can remove the mask. Remember, if you're in airborne precautions though, the mask should never be removed until you're out of the room. Now, that's the CDC approved way, but you can see how there's still kind of a high risk of contamination. So we want to show you another method that is not what the CDC recommends, but it's what most of us use in the real world. So we're going to use the same PPE, gown, mask, goggles, and gloves. Now, this method works best with plastic gowns that break easily. If you've got cloth gowns that tie, you're going to have to use the CDC method. So instead of removing your gloves first, you're going to grab the gown at the front and pull forward. You ball it up inside out, and then carefully remove one glove over the gown, reach inside the other glove and remove it inside out as well. Again, now you're only touching the inside and you can throw it away. Now you can take off your goggles, take off your mask, wash your hands, and you're done. So you can see how that is much more efficient, much faster, and honestly more practical. Now, just make sure that you're not mindlessly ripping off your PPE. You still need to pay close attention to what is and isn't contaminated and protect yourself and other patients. So I hope this was helpful. You know, one of my favorite ways to practice this is to get a plastic gown and put shaving cream on the outside of my gloves and gown. If you can get it off without getting shaving cream on your skin, you know you did it right. All right, guys, go out and be your best selves today. And as always, happy nursing.